Your kidneys can quietly lose a third of their working power before you feel a single thing. No pain, no warning. And by the time most people finally notice, the damage is often years deep. I am Dr. Hale. In my 15 years in internal medicine, I have watched this happen more times than I can count. A patient walks in feeling fine, maybe a little tired, maybe a little puffy in the ankles, and their lab work tells a very different story. Their kidneys have been struggling in silence, and nobody caught it. Because kidneys do not shout. They whisper. And most people never learn the language. Here is what should get your attention today, even if you feel perfectly healthy. The Centers for Disease Control and Prevention estimates that more than 1 in 7 American adults has chronic kidney disease, and as many as 9 in 10 of them do not know they have it. Read that again. 9 in 10. These are not people ignoring some obvious symptom. These are people who genuinely have no idea, because the early signs are so easy to blame on age, on stress, on a bad night of sleep. And this is not a problem that begins at 70. The wear starts in your 40s and 50s, quietly, while you are busy with everything else. So this is a video to get ahead of it, not to panic about it. The window to protect these organs is widest right now, and it is wide open for you today. In the next few minutes, I am going to walk you through 7 early warning signs your kidneys may be struggling. Some of them will surprise you, because they do not feel like kidney problems at all. The sign at number 3 is the one most people get completely backwards. And stay with me to the end, because there is one final sign that almost nobody checks, and it is often the very first one to appear. Let me start with why your kidneys matter so much, because once you see it, these signs stop feeling random. Picture 2 filters, each about the size of your fist, sitting just below your rib cage in your back. Every single day, they clean your entire blood supply many times over. Think of them as the quiet cleaning crew of your body, working the night shift, hauling out the trash while you sleep. They pull waste and extra fluid out of your blood and send it away as urine. But that is only part of the job. Your kidneys also help control your blood pressure. They balance the minerals that keep your heartbeat steady. They send the signal that tells your body to make new red blood cells. And they help keep your bones strong. So when they slow down, the trouble does not stay in one place. It spreads. Now, the 7 signs. Walk through them with me and count how many sound familiar. Sign number 1. Fatigue that sleep does not fix. When your kidneys fall behind, waste builds up in your blood, and your energy drops. There is a second reason too. Healthy kidneys release a signal that tells your body to make red blood cells, the cells that carry oxygen to every corner of you. When the kidneys weaken, that signal fades, and you can slide into anemia. The National Kidney Foundation lists this deep, stubborn tiredness as one of the most common early signs. It is the kind of fatigue where you sleep 8 hours and still wake up feeling like you climbed a mountain in your sleep. Easy to blame on getting older, often something more. Sign number 2. Swelling, especially in your feet and ankles. When kidneys cannot clear extra fluid and salt, that fluid has to go somewhere, and gravity pulls it down into your lower legs. You might notice your socks leaving deep marks by evening, your shoes feeling tight when they fit fine that morning, puffiness around your eyes when you wake up. The National Kidney Foundation points to this fluid buildup as a classic signal. One puffy day after a salty restaurant meal is usually nothing. A pattern that keeps coming back is a conversation with your doctor. Sign number 3. Here is the one most people get backwards. Changes in your urine. Most people assume kidney trouble means you make less urine, and sometimes, late in the game, that is true. But early on, it often goes the other way. You may go more often, especially at night, getting up 2 or 3 times when you used to sleep straight through. Or you may notice foam. Not a few bubbles that clear in a second, but a frothy look that lingers, like the head on a poured beer that will not settle. That foam can be protein leaking into your urine, and protein in the urine is one of the earliest, clearest signs that the filters themselves are damaged. So it is not always less. Sometimes it is more. Sometimes it is foam. Remember that one. Sign number 4. Dry, itchy skin that lotion does not touch. Your kidneys keep the right balance of minerals in your blood. When that balance drifts, one of the first places it shows is your skin. A deep, all-over itch, especially at night, is something patients rarely connect to their kidneys. But the connection is real. Sign number 5. A foggy, slow mind. Trouble focusing. Losing the thread of a sentence. Reaching for a word that used to come easily. When waste builds up in the blood and oxygen delivery drops from anemia, your brain is one of the first organs to feel it. People blame this on age, on distraction, on doing too much. Sometimes the real cause is the pair of filters in your back. Sign number 6. Muscle cramps and restless legs. Your kidneys manage minerals like calcium and phosphorus, along with the balance of fluid around your nerves and muscles. When those numbers slip out of range, muscles twitch, cramp, and refuse to settle at night. If this sounds like the magnesium video I made, you are paying attention. The signs overlap, and that is exactly why a real test matters more than a guess. Before I give you the 7th sign, the one almost nobody checks, do me one small favor. If this is helping you see your own body more clearly, take 1 second and subscribe to Dr. Hale. And tell me in the comments how old you are, because the age of the people watching genuinely shapes what I cover next. All right. Back to it. Sign number 7. The one almost nobody connects to their kidneys, and often the very first to appear. Blood pressure that keeps creeping up. Here is the loop that makes this so important. Damaged kidneys struggle to manage fluid and certain hormones, and that pushes blood pressure up. But high blood pressure also damages the tiny vessels inside the kidneys, which makes the kidneys worse, which pushes pressure higher still. It is a wheel that turns in one direction, and each turn tightens the other. So rising blood pressure in your 40s, 50s, or 60s is not only a heart matter, it can be your kidneys quietly asking for help. And almost nobody checks it that way. Now, before the patient story, let me tell you who should be paying the closest attention, because 2 conditions cause most kidney disease in this country, and both of them are common after 40: high blood pressure and diabetes. Picture what high pressure does inside those filters. Your kidneys are packed with millions of tiny blood vessels doing the actual filtering. High blood pressure pounds through those delicate vessels, the way water hammers a garden hose turned up too high, and year after year they stiffen and scar. High blood sugar does its own damage, coating and injuring those same small vessels from the inside until they leak. So diabetes and high blood pressure are not separate from your kidneys at all. They are quietly wearing down the very plumbing your kidneys depend on. If you have either one, or a family history of kidney trouble, your kidneys are counting on you more than you know. And there is one more group I want to name plainly, because it gets missed. People who lean on over-the-counter pain pills. The common anti-inflammatory relievers, the ones so many people take for aching knees and stiff backs, are hard on the kidneys when used often and in large amounts over many years. An occasional pill for a headache is not the worry. A daily, long-running habit is. I have seen kidneys wear down from nothing more dramatic than a decade of well-meant pain relief. Now let me tell you about a patient. I will call her Marta, and she is a composite of many people I have seen. 61 years old, retired school teacher, the kind of person who never misses her morning walk. She came to me tired. Not sick, just worn thin. Her ankles were puffy by dinner, She was getting up twice a night to use the bathroom and blaming her age. Her blood pressure had drifted up over 2 years, and she had figured that was just what happens. Every one of those things, on its own, is easy to wave away. Together, they were a pattern. We ran 2 simple tests. Her kidneys were already working at a little more than half of normal, and protein was leaking into her urine. Marta had no pain. None. She had assumed that meant she was fine, and that assumption is the most dangerous one I fight in my office. Which brings me to the honest part of this video, the part this channel is built on. Let me clear up 3 myths that keep people in the dark. The first myth: that kidney trouble hurts. It usually does not. These organs have very little ability to signal pain until something like a stone or an infection gets involved. Slow, chronic damage is silent almost the whole way. Feeling fine is not proof that you are fine. The second myth: that one normal blood test settles it. Many people get a standard blood panel, see a normal reading, and relax. But the single most sensitive early test is not always in that basic panel. It is a urine test that looks for small amounts of protein, called an albumin to creatinine ratio. Your kidneys can be leaking protein while a basic reading still looks acceptable. If you take nothing else from this video, take that. The third myth: that a detox tea or a cleanse will scrub your kidneys clean. Your kidneys are the cleaning system. They do not need a tea to do their job, and some of those products can actually make things harder for them, which I will come back to in a future video. A cleanse is not protection. Real protection is knowing your numbers. Here is the good news that the scary videos never give you, and it is the whole reason I made this one. Catching kidney trouble early changes everything. Those 2 tests I mentioned are quick, cheap, and painless. The blood test gives you a number called eGFR, an estimate of how well your kidneys filter, and it is easy to read once someone shows you the scale. A number above 90 is generally healthy filtering. As it drifts below 60, doctors start watching more closely. The urine test can flag a protein leak even earlier, sometimes before the eGFR has moved at all, which is exactly the head start you want. Kidneys caught early can often be steadied for decades with nothing more dramatic than better blood pressure control and a few steady habits. Kidneys caught late have far fewer roads left open. That gap between early and late is the entire game, and it is sitting inside a test that takes 5 minutes. So here is what to do this week. Simple, concrete, and worth more than any supplement. 1. Ask your doctor for 2 specific tests. A blood test called eGFR, which estimates how well your kidneys filter, and a urine test for albumin, the protein leak I described. If you have diabetes or high blood pressure, the 2 biggest drivers of kidney disease, you have every reason to ask. 2. Know your blood pressure and treat it seriously. Getting it into a healthy range is one of the most powerful things you can do to protect these organs for the next 20 years. 3. Go easy on the over-the-counter pain relievers. The common anti-inflammatory pills, taken often and for a long time, can strain the kidneys. Occasional use for most people is one thing. A daily habit is worth a conversation with your doctor. 4. Watch your salt and stay sensibly hydrated. Not gallons of water to flush yourself out. Just steady, ordinary water through the day. Enough that your urine stays a pale straw color rather than dark. When you let yourself run dry over and over, especially in summer heat, your kidneys have to concentrate everything and work harder than they should, and repeated real dehydration is an underrated way people quietly injure these organs across a lifetime. Pair that with less of the hidden sodium in processed food, the salt already stirred into the products you trust, and you take a steady load off the filters every single day. Now, one clear line before we finish, because it matters. Everything I gave you today is education, not a diagnosis, and it is not a substitute for your own doctor. I do not know your history, your medications, or your lab numbers, and there are signs that are not slow and quiet at all. If you are passing very little urine, or you see blood in your urine, or you have sudden severe swelling with shortness of breath, or you feel confused and deeply unwell, that is not a wait-and-see moment. That is a call to a doctor, and some of it is a call today. Whether you are 45 or 75, you are never too early and never too late to protect these two quiet filters. Most people wait until their kidneys are finally shouting. You do not have to be most people. And here is the thread I want to leave you with. Once you understand how silent this damage is, the next question is the obvious one. What is quietly straining your kidneys every day without you knowing? Because the answer is going to surprise you. Some of the foods marketed as the healthiest choices on the shelf, the ones you might be eating right now because you believe they are good for you, can put real pressure on aging kidneys. In my next video, I am going to name 5 of them. Subscribe so it lands in front of you.